just text me.
And then how do I share screen? I click the share button down here.
You should have, are you on your computer?
I am.
At
My
the
left.
bottom of the screen, do you have a share button?
Yeah, that's all you have to press.
Yeah, if you want to load it, I'll make sure it looks good.
All right, share screen. Okay.
Yeah, that's working.
All right.
You want to
From
just make
slideshow.
sure in, yeah, slideshow mode, it flips through, okay?
Okay, that should work.
Looks good. Okay. I gotta hop off, but if for some reason when I hop off it crashes or anything, text me.
Will do.
All right, thanks.
Absolutely. All right. Can you all hear me? Fine.
Yeah, we
Yep.
can hear you.
Perfect. All right. So at the end of this, also, if you can send me any feedback, so I'm also giving this lecture next month to the statewide Athletic Trainers Association. So you are all my guinea pigs for this one. So uh, feel free to give me any positive or negative feedback. I'll appreciate it. Um, but so the kind of topic today we're going with is the supplement use in athletes. The reason I thought is every day, at least several times, I have patients, even older folks that are asking, "Hey, what can I take for this?" Someone recommended this, and I feel my throwaway answer is always, "Oh, well, try it out. If it works, it works. If it doesn't, like, don't waste your money." Which that still holds true. And as we kind of go through and talk about some of these supplements and whether they work or not. Um, that's still kind of the case. I don't think overall there's anything that's overarching that you definitively have to use something. But still, I think it's worthwhile to know what supplements are out there, and if someone's looking for a specific reason to use one, how you can kind of best steer that particular patient or athlete in that direction. So no disclosures, and unfortunately, I don't have any supplement supporters to pay me money. The goals for today, just kind of learn about different supplements that are commonly out there, be able to be knowledgeable in discussing them with your patients and athletes. You'll be able to know any potential risk and side effects of the supplements, and then if someone is looking to purchase, how to recommend they go about doing this in a safe way, so they don't pop positive any sort of drug testing that may come about. So, what is a supplement? So, according to the dictionary, it's anything that something that is added to something else in order to make it complete. Very basic. According to the Olympic Committee, the IOC, it's a food component, nutrient ingested with the aim of achieving a specific health and/or performance benefit. So, in our case, the athletes, it's really that performance benefit that we're concerned about. And then from the USDA, it's a dietary ingredient intended to supplement the diet. Again, adding a part to make a whole. And this comes in a variety of things. The most basic is something as simple as a multivitamin, different amino acids, all up to things like certain enzymes and probiotics. So supplements really the greatest thing since sliced bread. I'm sure you're well aware of marketing on TV, Instagram, the radio, promoting some of these supplements that you can purchase online over the counter, and they tell you it's going to increase your strength, faster recovery, better energy, less muscle fatigue. If that's the case, sign me up. I'm sure all of you would agree if there's a simple pill you could take and you'd feel great and gain muscle strength, and it's not something like an anabolic steroid, we'd all be for it. But unfortunately, the water is a little more muddier than that. So in the early 90s, there's only about 4,000 supplements available. Today, you're getting closer to 100,000. So that market's really expanding. In the US alone, it's a $25 billion industry annually, with estimates that's going to nearly double within the next 10 years. And supplement use isn't just in elite and high-end athletes. Studies suggest that 60% of high school football players have tried to use protein powder regularly, and 30% use creatine. So even at a younger age, they're starting, and then as you get up in skill level, it approaches nearly 100% are using some type of supplement. So very common in our population. So to begin, as far as the supplements that are out there, we'll start with creatine. I would say probably outside of protein powder, this is the most commonly used and the most well studied. It's been around for probably the past 30 years in use, and it's definitely become more prevalent during that time. It's made up of 3 amino acids: glycine, arginine, and methionine. It's stored in our skeletal muscle as phosphocreatine. But by supplementing, you can increase your stores by about 30%. So how does this, affect our cellular function? How does this improve our athletic performance? Well, as you can recall from college biology, phosphocreatine is utilized in ATP generation, which is how our cells make energy. And so if you have an extra 30% phosphocreatine readily available, that directly translates to quicker energy production. Which I think is probably a good time. Do we want to spend some time going back over oxidative phosphorylation? If you guys all remember from high school biology, or should we skip this part? I think we're gonna skip this part. It's my attempt at some poor humor on a Friday morning. I don't recall the electron transport chain ATP synthase, but at the end of the day, we use that phosphate group from the phosphocreatine to make ATP for cellular energy. So creatine is naturally found in a lot of protein products. So as you can see, beef, pork, salmon, about 2 grams per pound. But that's obviously, you have to eat a pretty robust diet, taking a pound of meat just to get 2 grams of creatine. Whereas most scoops from a supplement, you're eating 5 grams in a tablespoon. So that's where kind of supplementation has its benefits, where you can kind of get even more of the creatine in a smaller dosing. So, what does it do for us? I think the first time we became aware of creatine was back in the summer of '97. Sammy Sosa, Mark McGwire having their home run race to break, I think it was Babe Ruth's record of 70 home runs in a season. Or sorry, to Roger Maris. But anyways, it was all over the news how Mark McGwire was taking this supplement called creatine. It was giving him extra strength, and he was kind of cheating the system. I think ultimately it was found that he was taking creatine, but it was probably some other more illicit substances giving him his strength, which eventually he was found to be using steroids. But that's kind of the first time I became aware, and kind of thinking back, kind of how supplements have changed over time. It was almost vilified at that time, but now I would say this is pretty omnipresent, definitely in our athletic population. But I even know just regular, kind of weekend warriors that this is part of their regular intake. So as far as kind of its benefits, primarily it's been found to improve maximal strength and power output. And this is really in those high intensity, short duration exercises. So think, powerlifting, where you're doing kind of one quick motion to get a maximal rep, sprinting, and really so these short, less than 150-second duration burst is where it's been found. Again, if you're thinking back, it's kind of regenerating that ATP as quickly as possible. So the short duration where you burn through your energy supplies and can restore it is where it's going to be helping out. There hasn't really been found any benefit on endurance athletes. Not to say it can't help with just their overall strength and power, but as far as helping with distance, hasn't really been shown in that regard. As far as recovery, the data's been mixed. There was a meta-analysis in 2021 that didn't really show much benefit as far as reducing muscle soreness or inflammatory muscle cellular markers from 24 hours out of exercise up to 96 hours. But a more recent study in 2025 did show that at 24 and 48 hours following exercise-induced muscle damage, the reported symptoms associated with delayed onset muscle soreness had reductions at 24 and 48 hours compared to placebo, as well as improving power and completed repetitions based on the kind of percentage of 1 rep max. So what the study did is they had people kind of get the 1 rep max. They had them then do so many sets to fatigue them. They gave that, and then they were taking the creatine for supplement, and they brought them back 72 hours later to do the same exercise event. And so the patients that were taking the creatine versus placebo were able to kind of get back to their baseline and complete actually more repetitions compared to those that were not taking creatine. So potentially does have some benefit in quicker return to function and recovery. I think what's most interesting about to me with creatine is kind of how this is now going more into kind of the cognitive realm. So, historically, you're probably aware about its, benefits with, strength and power. But now there's some, limited data suggesting potential concussion recovery benefits. Overall, these trials have been kind of limited to animal models will induce traumatic brain injury. And the animals that are taking the supplement have been shown to have about a 50% reduction in in axonal damage compared to those not taking. It hasn't really played out in human trials just yet, very limited studies, but that's something I think that's coming down as far as being looked at into potentially. So if you have an athlete that has concussion and they're already taking creatine, great, keep it up. If they're not and they're asking, hey, is there anything out there that may benefit? This is something you could counsel them on. Also, sleep deprivation. There's some studies that show that those that are in a single loading dose of 0.35 milligrams per kilogram of creatine taken one time, that those were the sleep deprived for 20 hours showed improved cognitive function and reduced reported tiredness scores compared to not taking supplement. So again, if you're traveling with a team, you're going across time zones, or if you have an athlete that was, hey, I was anxious the night before and didn't sleep much, this may be something that they could look into to doing like a one-time kind of loading dose to help out with their functioning. The recommended dose is 5 grams per day. You could consider loading at the start for 20 grams per week. There's really minimal side effects to using. Potentially, there is some weight gain initially, secondary to water retention. So you want to be careful with athletes that are trying to make weight, so like wrestlers, boxers. Not to say they can't use creatine, but I wouldn't recommend starting them probably within like a month of an event because you want to have the time for their bodies to adjust to that change. One of the big myths is that creatine adversely affects renal function, and the reason this is thought of is if you're using creatine, you'll tend to have a higher creatinine, and it really hasn't been shown to have adverse effects on the functioning because your GFR remains normal. And so really that increased creatinine is just purely from the conversion from creatine to creatinine. So again, something, make the patient aware, hey, if you get your lab test done pre and post, you may have this elevation, but it's not actually causing renal damage. Of note, the American Academy of Pediatrics, as well as the American College of Sports Medicine, do not recommend supplementing for those less than 18 years old. However, obviously this does occur. There's not really data looking in athletic endeavors of the effect, but there are some studies out there with patients, adolescents that have muscular dystrophy that have used creatine, and it hasn't been shown to have any adverse events for the supplement. So again, if there's a high school athlete that's inquiring about it, and you have this discussion with their parents, you can at least share that knowledge with them. Next one is N-acetylcysteine. This is one that I was kind of just learning about going through making this presentation. It's marketed as an antioxidant. If you're probably the Joe and Kelsey, you're probably more familiar with its use in the ER setting as a counterproduct to acetaminophen overdosing. It helps to replenish methionine in the liver that can basically binds with the acetaminophen breakdown product that causes hepatotoxicity. However, there is some also limited data on its benefits in helping recovery from concussion. The study back in 2013 looked at around 80 soldiers that had a mild traumatic brain injury during a deployment, and it kind of split those up into 4 different groups. One group received the N-acetylcysteine, the one group did not, and then it was also kind of subdivided into early intervention or delayed intervention. The early intervention was within 72 hours, within 24 hours of treatment. they had proper counseling about concussion as far as rest and light activity and for recovery versus delayed for more than 24 hours, having that intervention. And so overall, if you had early intervention, whether you're taking the supplement or not, you have a fast recovery. However, those that were in the early intervention group that were taking the N-acetylcysteine supplement had 86% resolution of their symptoms, which is more than double for those with taking early intervention with placebo at 7 days. So potentially this can expedite a kind of a faster recovery from percussion. Pardon me. And this also was translated into another more recent study that looked at patients a little bit older and greater than 60 years old. And they looked at their symptom scores at 7 days out from the initial injury and then 30 days out. And those that were supplementing with N-acetylcysteine during that time had improved scores compared to placebo. So moving on with caffeine, something I think we're all very familiar with, whether it's your intake with coffee, tea, or chocolate. And obviously, most of us aware that gives us improved energy, alertness, wakefulness. That's done by blocking adenosine receptors in the brain, which increases catecholamine and endorphin releases. It also has some positive effects on the heart as far as the contractility and timing. As far as athletic endeavors, it does have been shown to have some improvement, more for the kind of the cardiovascular, but as we'll talk about in a minute, there are also some studies that show with power, it also helps. So with aerobic endurance events, has been shown to increase time to exhaustion. Kind of one of the thoughts is that catecholamine release, and endorphin release, kind of gives you that, let you sense less pain while running, so that kind of runner's high, and that may benefit from there. But again, you can kind of see the widespread as far as the effects goes, but it does show benefit overall. There's also improved time trials, but again, it's statistically significant. Hard to say it's clinically significant if it's only changing by less than 1%. But you can imagine in a close race that may be the difference between first place and second place. They've also looked at it, how does it affect kind of shorter distances for the anaerobic effect. And it showed some increased mean speed as well as time reduction in a 1 kilometer cycling event. And then they kind of also wanted to look at, hey, how does this affect team sports? So if you can imagine if you're on, playing in a soccer game and you're doing like a short little burst of speed to chase down a ball, and then you're kind of resting up from that, and then you're running again. Or maybe in baseball, you're stealing from first to second, that quick burst. It has showed an increased peak power in those quick sprint intervals. And then lastly, with powerlifting, it has been shown. 2025 study showed an improved power at 75% and 90% one rep max with back squats compared to placebo. And it felt to me what was really interesting is this 2015 study where they kind of they compared people that exercise in the morning versus their evening. And kind of, we all know if you work out in the morning, you tend not to feel, you lose some of your strength just from the timing. But if you take caffeine about 30 minutes beforehand, you can actually equal your power velocity to what you have in the evening. So if you're only able to work out in the morning and you have some caffeine beforehand, you still can achieve kind of your high performance goals that you may have, which you would rather be able to assess in the afternoon. So the dosing is 3 to 6 milligrams per kilogram, taking about an hour before the event. The studies haven't shown any benefit taking more than 9 milligrams per kilogram. And it only kind of increases your risk of side effects, which include nausea, restlessness, and insomnia. One of the things you may want to consider is having your athlete, if they're using caffeine regularly, having hold it for about a week before the event. Now, that unfortunately can cause some withdrawal symptoms. But to maximize the athletic performance, that supplement should be kind of just started the day of the event to have that response. Otherwise, your body kind of loses that responsiveness. With ashwagandha, it's a fun word to say. These are one of these things I think doing Brown's physicals a couple years ago. I think everyone that was coming in was taking ashwagandha. I was like, I've never heard of this ever before, but every player was taking it, and at that time, so I've become first familiar with it. And most of it's purported is it's for improving memory and decreasing stress. That's kind of the big marketing. And there's been some studies that show, improved stress scores, improved sleep quality scores with those taking it. Also, physiologically, those supplementing have had decreased AM cortisol levels. So, a direct physiological marker of our stress levels are improved if you're on ashwagandha versus not. There's some limited studies out there as far as muscle strength and endurance. As you can see, there was a 2015 study that looked at amateur weightlifters, and they were supplemented with 300 milligrams twice daily versus placebo for 8 weeks. And those on the supplement improved their 1 rep max for bench press and leg extension compared to the placebo group. And then a 2012 study looked at elite Indian bicyclist training over their 8 weeks, and those were in the experimental group showed improved VO2 max, so improvement in their aerobic fitness levels. It didn't comment on much as if it affected their time overall, but can eventually improve their aerobic performance if you have improved VO2 max. With omega-3 fatty acids, probably most of us are familiar with its use for cardiovascular benefits, but there has also some athletic benefits that may be there. The big thing is most of us aren't getting enough daily intake of our fatty acids. In fact, a study of Division I athletes, they're looking at what's called their omega-3 index, which is a serum test that looks at the percent of omega-3 fatty acids within red blood cell membranes. The ideal index is 8 to 12%, and no Division I athlete reached this goal. And more surprisingly, only 6% were only meeting their daily recommended intake of 500 milligrams of omega fatty acids. So definitely some room for improvement there. A study in 2023 showed improved running economy and improved aerobic fitness with VO2 max in amateur runners with some high dosing of omega-3 fatty acids. There was a position statement from the International Society of Sports Nutrition in 2025 that really was kind of not for or against supplementation. It showed reduced visual analog scale scores at 24, 48, and 96 hours following exercise-induced muscle damage, but there were no reduction in biomarkers, and it didn't show any benefits as far as recovery back to baseline with strength with dosing. So, but again, if an athlete's coming to you and saying, "Hey, I feel sore after workouts," maybe this is something that you can tell them it's not going to necessarily benefit as far as they're improving their strength, but they may just feel better within 24 hours after an intense workout if they're properly supplementing with the fatty acids. And then again, kind of bringing it back, concussion, mal-TBI. There's some promising animal studies out there with like rats and rabbits where they're induced they'll induce kind of concussions. Then there's been shown reduced neuronal death, cerebral edema, and behavioral deficits compared to placebo. Unfortunately, fatty acids have not been shown in humans taken prophylactically to reduce concussion risk. However, there are some data points, some studies that looked at college football players that were supplemented with omega-3 fatty acids throughout the season. And those that were taking the supplement versus those were not had a reduced serum neurofilament light serum finding, which is that particular serum study is a marker of axonal damage. So it does show maybe that suggests it could be, neuroprotective in such a way. Maybe not to the point that it's, mitigating the risk for concussion, but those repetitive blows over time, as kind of people talk about like CTE, long-term, that repetitive impact maybe this is something you can maybe stabilize the neurons and reduce the risk for long-term neuronal damage. Turmeric, probably more commonly known as a cooking spice, but it's primarily recommended use as a recovery agent. Multiple studies out there have shown it reduces muscle soreness as well as improved visual analog scale scores at immediately post-exercise, within 48 hours, and within 72 hours of exercise. So again, if someone's saying, hey, every time I work out, I just feel really sore after, recommending they supplement with turmeric may benefit them. There's also some more limited data that it speeds up the recovery of muscle function, so getting back to their kind of baseline strength post-exercise compared to placebo groups. Typical dosing is what I recommend patients is about 1,000 milligrams a day. That range goes from about 500 to 1,500 milligrams. The biggest thing is it can cause some upset stomach. And then in very rare instances, it can cause hepatotoxicity. But the dosing is about 5 times more than the recommended daily limit. So you really have to be pretty heavily dosing for that to occur. With branched-chain amino acids, it's made up of 3: the leucine, isoleucine, and valine. The leucine is really the key one. This directly stimulates what's called the mTORC pathway for muscle protein synthesis. Those are taking supplements also show reduced biomarkers for muscle damage. So kind of reduced CK levels at 24 hours and 48 hours following exercise, as well as subjectively reduced symptomatic scores during that same time frame. It doesn't show any improvement with muscle function as far as performance, getting back to your strength, time to exhaustion, or power. But we know it does help facilitate muscle growth in the long run, as well as reducing kind of muscle soreness after activity. So again, something if you have an athletes that are regularly lifting weights, this is something you should consider taking just to help with that protein muscle synthesis as far as our long-term goals. With sodium bicarbonate, also known as baking soda. I said the two. Baking soda. This works as working as an intracellular buffer. So when our muscles contract to make ATP with hydrolysis, that cleaves off a hydrogen ion. This hydrogen ion then builds up in the muscle cells, leading to acidosis and muscle fatigue. When the baking soda is ingested, this raises the pH in the stomach, so it makes it more basic. And then because of that hydrogen atom in the muscle cell is pulled down its gradient into the kind of the stomach stomach cells to be buffered by the bicarbonate. And so by reducing the acidosis in the muscle cells, you reduce that muscle fatigue. Now, some of the side effects of taking this are kind of bloating, nausea, and belching. It suggests you take a carb-heavy meal before its use may mitigate that. As far as the benefits go, it has shown some improvement with single bout high-intensity exercise. But however, if the exercise is less than 30 seconds or greater than 12 minutes, it hasn't shown to have benefit. So the less than 30 seconds, it's really probably not building up enough acidosis for that to occur. And if you're getting more into the 12-minute, you're probably not, using more of your aerobic fitness opposed to the anaerobic system that builds up that acidosis. So as far as what's been, the studies that have been out there have shown improved cycling power from 2 to 4 minutes, reduced running times for events from kind of that middle distance, 400 to 1,500 meters, and then reducing exhaustion with incline running with no kind of endpoint. Also improved repetitive short bursts, so kind of the same high intensity all-out efforts, but no power improvement with initial sprints. The kind of the study they did there is they had but the participants complete 6-second all-out sprints followed by a 30-second rest period, and they did that for 5 consecutive sprints. Again, kind of emulate soccer, for the example, where you're kind of running after a ball, you catch up to it, maybe pass off, and you kind of recover before you have to sprint again. And so that the first 1 and 2 sprints, it didn't show because no change in power compared to kind of the placebo, but the ones that were taking the supplement showed improved power and not a drop off in sprints 3, 4, and 5. Doesn't improve strength. However, it may reduce fatigue-induced decline. So there was a study of basketball players, and what they did is they tested their 1 rep max with leg extension prior to a game and then after the game. And those taking the baking soda supplement or bicarb supplement had a 9% reduction in strength compared to those taking placebo, which had a 15% reduction in strength. So hard to say, clinically it makes a difference, but in competitive sports, I guess every bit counts. Nitrates, everyone loves beets, but this kind of works with increasing nitric oxide availability to lead to blood vessel relaxation, to improve muscle oxygenation. So a lot of pre-workouts. This is kind of how they work. All those like NOS, like No Explode. Those are all basically just increasing nitric oxide. You always get through a lot of dietary green leafy vegetables. Primarily, the benefits have been shown in recreational athletes. And the way they determine recreational athletes is if their aerobic fitness level was less than 60. It showed if someone is taking nitrite supplements, improved endurance has been shown with increased time to exhaustion, as well as increased peak power outputs with sprinting. This supplement can be taken 2 to 3 hours prior to the event, or even chronically, has been shown similar benefits. With elite athletes, the data is a little more mixed. However, with chronic supplementation, it has been shown maybe to have some benefit with muscle endurance and peak power if used chronically. Collagen's a big one. I think a lot of people supplement this because, for a lot of just like skin concerns, with aging. Collagen is how for athletes, how we can kind of guide them is if they're recovering from like a tendon strain. Collagen makes up about 65 to 85% of our tendons, whereas muscle is only about 5%. And so some studies have looked at kind of its effect on joint pain, because again, our joints are made up primarily of the hyaline cartilage. And they did some studies. There was a 12-week study as well as a 24-week study. I think collegiate athletes, they were either club athletes or Division I athletes. And it showed that those had functional joint pain. So not an injury involved, but someone's coming to, hey, my knee hurts, my elbow hurts, my shoulder hurts. No really mechanism of injury. It did show with the supplementation have some improved pain at rest with walking and with lifting. So something you can counsel, maybe not even athletes, but a lot of our kind of older patients walking around with arthritis, and this might be something to recommend to them. It doesn't show any improvement in muscle synthesis. Again, muscle only made about 5% of collagen opposed to tendons. So the big one is, you may want to consider with athletes recovering from a tendon strain, Achilles strain, tennis elbow, that limited data, the NF was 8, but those that took 15 grams of collagen 60 minutes before their rehab had 150% increase in collagen synthesis compared to placebo. So if someone's recovering, and this is something, even if you're doing like PRP into someone's tendon, you may want to recommend them taking collagen to kind of fully optimize the recovery from that. Beta-alanine, this is also similar to the baking soda. It works as a cellular buffer to reduce hydrogen accumulation and reduce acidic buildup. Again, very similar to the sodium bicarbonate. it's really most effective in those kind of short anaerobic events. Um, and most studies show kind of 1 to 4 minutes. So again, anything less than that, you're probably not building up enough lactic acid to require the buffer, and anything longer, more endurance event, you're using more kind of aerobic system. And it did show that some studies improve time to exhaustion. So if you're kind of just running for as long as until you kind of tap out, but in events that have a very fixed endpoint, so like a specific race, like an 800-meter run, 1500-meter row, that data is more mixed as far as hasn't really been shown to improve the times there. As far as strength training, there is some data primarily in untrained subjects. So a novice, someone just starting out a weightlifting program, has shown increased isometric and isokinetic strength compared to placebo. However, those benefits, when they just kind of compare it to overall whole body strength, not statistically significant. So hard to say how much there. And then with professional athletes, again, more mixed there. With a short course of use, it hasn't been shown anything. However, for long-term use, this is more than 3 months. The study was more than 12 weeks. And they tested an increase in 18% in total strength and 19% in vertical jump power compared to 6% and 12% for those not taking the supplement over a 12-week course. So even your trained athletes may show benefit, improvements with strength and power taken over a longer period of time. Oh, sorry. Ignore that last part. That's for the next slide. So the beta alanine, sorry, that's primarily is going to be has been shown to reduce time to exhaustion, kind of similar to the bicarbonate. The HMB, so this is the one that has a greater effect on the untrained athletes versus the trained athletes. So HMB is a precursor or metabolite of leucine, which we talked about previously with the branched chain amino acids. So very similarly, it works by activating that mTORC1 pathway for protein muscle synthesis. And in untrained athletes, those that were supplementing during a resistance training program showed increased fat-free mass and reduced markers of muscle damage. Improved strength, so with isometric strength, peak power, and the 1-rep leg press. And then interestingly enough, they did some studies on folks that were basically activity restricted following hip replacement and knee replacement. And so, the concern is when you're recovering from surgery, you can't be active, you lose your muscle mass. But those who are taking HMB were able to maintain their strength for 14 days and 30 days following their surgery, and maintain their lean body mass at 10 days out of surgery. So if you know an athlete's going to be going for recovering, going to undergo surgery, going to be out for an extended period from training, this may be something you want to recommend to them to minimize their losses. Glucosamine chondroitin, so these are the building blocks of cartilage. Not much data in its use of athletes. You'll see this a lot in kind of our older folks that are taking it for arthritis use. Actually, the American College of Rheumatology recommend against its use, given its paucity of data and its help. With that said, there are plenty of patients I talk to all the time that tell me that they use it and they like it. And so again, when you counsel someone, you say, hey, try it out. If it works for you, great. If not, there's pretty low risk of something like this. But specifically in athletes, 2015 study looked at ACL reconstruction recovery, and they over an 8-week rehab protocol. So they all had the same rehab, and there was no group difference for those taking glucosamine versus those not. And then a 2017 trial looked at soccer players taking glucosamine versus not, and they had reduced kind of serum markers of cartilage degradation. However, there was no endpoints that showed improved kind of functioning or reduced injury risk. So, you know, scientifically it's interesting, but clinically it probably doesn't make much of a difference. CoQ10, this is one I would say it's probably more. A lot of people take this to probably kind of the anti-aging benefits, used as an antioxidant to reduce kind of reactive oxygen species. From a sporting benefit, very small aerobic benefit, not much as far as anything with strength or anaerobic benefits. A 2026 systematic review also looked at kind of, hey, how does this help with just overall kind of muscle functioning? It did show reduced levels of MDA, which can be a sign of that's a measure of oxidative stress in the body. So it does show a reduction in MDA. It was kind of mixed effect on if it showed reductions in creatine kinase levels following exercise. And there was no effect in lactic acid or VO2 max. So the lactic acid was being a marker of anaerobic activity, and the VO2 max, the aerobic activity. So there's no benefits with CoQ10 supplementation in these groups. With protein, I'd say this is probably the most common supplement out there, and it comes in a variety of different forms, whether it's plant-based, protein-based, meat-based. Two main types are kind of the whey, which is kind of quick absorbing, and the casein is slow absorbing. The recommended daily allowance for the general population is 0.8 grams per kilogram per day. If you're athletes, though, you may want to recommend increasing from 1.2 to 2 grams per kilogram per day based on their kind of training goals and their activity levels. A 2018 study, systematic review in the British Journal of Sports Medicine, showed that overall supplementation, the effects diminish with age. So you kind of have the peak effect is when you're supplementing in your 20s, and pretty much every decade it declines down. Now, one of the notes they did make is the studies they looked at, the amount that was supplemented decreased with age as well. So maybe that's just kind of a causative effect. You take less protein in, maybe has less benefit on the back end. But what they did find overall is that those that were supplementing more than 1.6 grams per kilogram per day did not show any increased benefit for those taking more. It did show that those that were in a resistance exercise program did show benefits compared to placebo alone. They were able to increase their 1 rep max by 2.5 kilograms and their free fat mass by 0.3 kilograms over the resistance exercise alone. But again, the placebo group was able to increase, so just with the exercise without supplement, they were able to increase their 1 rep max by 27 kilograms and their free fat mass by 1.2 kilograms. So yes, the protein does help to augment it, but hard to say if that's actually clinically significant or not. With protein supplementation, there's been no endurance benefit that's been found. And then no benefit as far as, which I was surprised, hasn't really shown to have any benefit with reducing muscle soreness, recovery, and strength training to getting back to their baseline. One of the things to be aware of is there's not such a golden hour. I always was learned or taught that, hey, if you were going to use protein, you need to take it within an hour of exercise. But meta-analysis from 2013 showed that once you exercise, your body's responsible, or 2011 study showed that once you exercise, your body's muscle has anabolic responsiveness for up to 24 hours out. So that supplement doesn't have to be done right away. It can be taken anytime within that day of exercise. So with magnesium, this is one that's primarily taken for muscle recovery. You should it's been recommended to increase the intake in athletes by about 10 to 20%. Studies have shown that it does reduce delayed onset muscle soreness if taken for 10 days prior to a training event. They also, and that was for, that was resistance training. Following a running event, it's also been shown to take reduced DOMS at 24 and 72 hours following a 10-kilometer time trial. So the next couple are kind of more recent ones, not really much for an ergogenic effect, but something that can help an overall kind of injury prevention. With vitamin D, we know that if you have low vitamin D levels, there's numerous studies that show collegiate athletes, military recruits have a high risk of stress fractures with low vitamin D levels. And so you probably want to recommend if you're living above the 35th parallel, which is where we're at, or definitely in Ohio, supplementing with 1,000 international units of vitamin D3 per day. The goal levels, if you are doing like screening, is to have a level between 50 and 80. But probably the easiest way is probably everyone that's, if you have an endurance athlete above that 35th parallel, is that make sure they're taking 1,000 international units a day to reduce the risk of stress fractures. B vitamins, help with energy production, a red cell blood cell production. If you're taking a regular kind of omnivorous diet, you're probably getting enough of these vitamins. With that said, if you have athletes that are vegetarians or vegans or any disordered eating, you should recommend taking a vitamin B supplement to reduce their improve their athletic performance, especially if they develop things like megaloblastic anemia. Very limited studies out there as far as if it works for any other performance benefits. There was one study that showed if taking vitamin B supplement for 28 days, it showed a 1.25% improved time to exhaustion running trial. So maybe something there, but probably more than anything, this is just to help those that are not having proper dietary intake, making sure they're not dropping off from that. Iron, ideally in athletes, you want their levels to be more than 50. Even there's no ergogenic benefit in supplementing with patients, athletes' normal levels, but if their iron levels are less than 50, even if they're not anemic, if their ferritin level is less than 30, taking iron supplement daily has shown improved aerobic capacity. So you can't have iron deficiency symptoms without having anemia. They kind of mirror one another with fatigue, exercise intolerance, irritabilities, headaches. These symptoms are more pronounced in those that do have the anemia. That's a lot of times when you catch it. But if you're doing, if you're screening your athletes prior to the season, and if their ferritin is less than 30, would recommend supplementing them to get them above 50 to prevent anemia from taking place. Particularly with endurance athletes, there's a condition called foot strike hemolysis. So that repetitive kind of impact with the ground causes the red blood cells to kind of be destroyed. So it puts them at higher risk for developing anemia. Peptides. So this is a hot button issue right now. I think there's just yesterday the Health and Human Secretary was on Capitol Hill was trying to get this to be defined as a supplement so it can be sold more easily. It's the way I kind of found peptides was in the past 3 or 4 months. I was listening to a podcast occasionally, and Joe Rogan was talking about it with some like retired Navy SEAL. And then the next day, I had someone, a CrossFit competitor, come in and ask me about peptides. And then the day after that, I had a bodybuilder come in and ask about peptides. So like within 3 days, I had never heard about this at all. And in 3 days, I heard about it consecutively. And so if you look out there, there's really no human studies at all. Like actually, a group of our surgeons here at UH did a systematic review last year and showed there was 35 preclinical studies and only one clinical study. The 35 preclinical studies looked at primarily rats and rabbits, where they would induce them with Achilles tendon injuries or other various tendon injuries. They would transect them, and then they would inject the peptide, and it did show benefits with tendon healing following that. However, the only human study to date was a retrospective study where they essentially there were 16. They found 16 people that had received peptide injections into their knee. Of those 16, 12 only had the peptide by itself. Some of the others had other things with it. Of those 12, 11 said they felt better 6 months out. So again, maybe it's something to be definitely needs looked at more. But this is something you're going to see patients, especially your competitive athletes, are going to be asking more about this. So just something to be mindful of. Educate them. Hey, there's some promising preclinical studies, very limited human trials. Right now, though, it is banned by the World Anti-Doping Association, the NFL, UFC. The other professional sports leagues, the NBA, MLB, NHL, don't have an official stance on peptides. But again, this is definitely something it's going to be in the news more common. I'm sure to have a lot of patients start to ask you about it if they haven't so already. So after all that, how do we, tell our athletes, our patients, how to find something safe? Overall, supplements are not FDA regulated, so that's why all these claims can be out there, and there's no real nothing you have to back that up with. Interesting enough, in 2015, the state of New York did an independent investigation in the Attorney General's office and found that 4 out of 5 supplements tested at GNC, Walmart, Target, and Walgreens did not contain the products listed on their label. There's also been multiple review studies. There was a 20 that showed also concerning findings. In 2004, 634 supplements were looked at from 13 different countries and 250 separate suppliers, and found that 15% contained anabolic steroids or a steroid derivative. A 2017 review article again found that anywhere from 15 to 60% of supplements contain either anabolic steroid compounds or amphetamines. The issue with this is, if your athletes think they're taking some basic supplement and it has contaminated products in it, they could fail a drug test and kind of ruin their careers. And you'll see this fairly often when an athlete, professional athlete, tests positive, and that's their claim. It's like, hey, wasn't taking any steroids. I was just taking some supplement. But unfortunately, we know these supplements can have contamination to them. So when recommending your athletes, you can use, there's an app online you can download. It's NSF Certified Sport. You can scan the barcode or you can type in the product name. And if it gets certified, that's basically saying that it's been tested independently, third-party testing, and doesn't contain any contaminants. They'll also have that label will be on the bottle of the supplement as well. Some other third-party testing agencies are also listed there. So something to be mindful of to tell your athletes to look for. So I know our time is short, but that's pretty much it. This is kind of the last few just review slides to kind of say if you're trying to see what to recommend for an athlete. So again, creatine, some studies show improved strength and power, not much on endurance. N-acetylcysteine may have some benefits for concussion recovery. Ashwagandha maybe have improved with sleep and reduced stress. Very limited studies for endurance and strength, though. Branched chain amino acids can help with muscle recovery. Sodium bicarbonate and beta alanine can help with kind of those short burst anaerobic capacity events. Collagen may help with collagen synthesis with exercise. So if you're rehabbing a tendon injury, maybe something to recommend. Glucosamine chondroitin, nothing really there to recommend for athletes. HMB has been shown to improve strength and power, primarily in untrained athletes. So that's pretty much it. If there's any questions, I know we trying to cover a lot there. Hopefully you were able to keep up along the way. But I think overall, this is something with our athletic population, but even just our, population in general, as people are living longer and want to optimize their functioning, you're going to get asked about supplements a lot. And you don't have to by any means have to be, taking these yourself, but I think having some baseline knowledge and how to counsel athletes and patients on their specific performance goals is more beneficial than saying, hey, try it out and see what happens. So that's all I have. If you have any other questions.
Did you happen to come across any studies showing like clinical outcomes with collagen supplementation?
Sorry, could you say that one more time, Heather?
Did you happen to come across any like clinical studies that showed like more clinical outcomes with collagen supplementation?
No, that's very limited. And that's overall like outside of creatine, which has like numerous studies, a lot of these have, a handful, and even like the handful, it's like very limited, like the N of like, 20. So that for collagen, that was the only study I could find that actually looked at any type of outcome in recovery. And I think that's what's kind of strange about supplements is like, right, where everyone's taking them, but there's not really any data out on the market. Not there's a paucity of data for most of these supplements, but yet they're the way they're not FDA regulated, so these companies can claim they do all these things, and it's hard to say what they do or they don't.
So back to the NAC, to the NAC, UH, and I was involved with this with Chris Bailey. We got to really close to actually having it happen, doing a trial with intranasal at collegiate level. But in order to get it single serve it, like single dose, was going to be really, really expensive. But the early literature that we reviewed for that, it's very promising. And it would be really easy if you could have this intranasal form of it because you just squirt it up the nose and it's great. But the problem is that you have to keep it refrigerated. It's single, you have to have it on hand. There's all these things with it. So I think that moving forward, it'll be interesting to see if we can find a different form that works as effectively.
Yeah. Yeah, that was that was the first time I heard of N-acetylcysteine was doing this. I was like, oh, that's actually something. Obviously, we see a lot of concussion athletes, and everyone wants to get back sooner. So I think even if it expedites by a few days, that can make a world difference. All right, everyone have a nice weekend.
Thank you.
Thanks, Josh.
Absolutely.